Our expert committee on the safety of medicines, the Pharmacovigilance and Risk Assessment Committee, has now come to a conclusion on the review of cases of blood clots in people vaccinated with AstraZeneca's COVID-19 vaccine. The committee has come to a clear scientific conclusion. This is a safe and effective vaccine. Its benefits in protecting people from COVID-19 with the associated risks of death and hospitalisation outweigh the possible risks. The committee also concluded that the vaccine is not associated with an increase in the overall risk of thromboembolic events or blood clots. Now, during the investigation and review, we began to see a small number of cases of rare and unusual but very serious clotting disorders, and this then triggered a more focused review. Based on the evidence available and after days of in-depth analysis of lab results, clinical reports, autopsy reports and further information from the clinical trials, we still cannot rule out definitively a link between these cases and the vaccine. What the committee has therefore recommended is to raise awareness of these possible risks, making sure that they're included in the product information. Drawing attention to these possible rare conditions and providing information to healthcare professionals and vaccinated people will help to spot and mitigate any possible side effects. We're also launching additional investigations to understand more about these rare cases, and we're conducting targeted observational studies. About 7 million people have now been vaccinated in the EU with the AstraZeneca vaccine, and 11 million have been vaccinated in the UK, and there is increasing use of this vaccine in other countries. It remains very important that all side effects are closely monitored and reported so that we can evaluate them and see if there's any need to update the information and warnings about possible risks. Dr. Strauss will explain the committee's evaluation in more detail, but I want to reiterate that our scientific position is that this vaccine is a safe and effective option to protect citizens against COVID-19. It demonstrated that at least 60% efficacy in clinical trials in preventing coronavirus disease, and in fact the real-world evidence suggests that the effectiveness could be even higher than that. We're very much aware that some member states have paused vaccinations waiting for EMA's outcome of a review. But given that thousands of people in the EU die every day, and in fact over 2,500 were reported one day last week, it really was crucial for EMA to review rapidly and thoroughly all the available evidence. So we made this review our highest priority, and our experts have worked intensively to analyse in great detail all the data available. We have mobilised European experts in the field of thrombosis and blood disorders to investigate, and we've worked closely with other health authorities across the world, including with the UK's MHRA. The scientific conclusions adopted today provide Member States with the information they need to take an informed decision regarding the use of the AstraZeneca vaccine in their vaccination campaigns. Before I hand over to Dr. Strauss, I would like to highlight that a situation like the one we have just seen here is not unexpected. When you vaccinate millions of people, it's inevitable that rare or serious incidences or illnesses will occur in the time immediately following vaccination. Our role in the EU regulatory system is to rapidly detect these incidents and investigate whether there may be a link to the vaccine or whether they are the result of illnesses which occur by chance close in time to the vaccination. We are committed to ensure that any new suspected adverse reactions are rapidly investigated to support decisions based on science, which can then support confidence in vaccines, which is so important in dealing with this devastating pandemic that we are facing. And we remain fully mobilised to ensure our public health role. Today's conclusion helps us to continue in the fight against this pandemic by raising awareness and providing up-to-date information as we have analysed it and as it becomes available, so that citizens across Europe are informed about what they need to do.